Hello? Hello, everyone. Thank you for your patience. My name is Anaïs Loisillon. Good morning and good afternoon to all of you joining us today. I hope you can hear me well. If you have any questions, feel free to also there's a questions box and a chat box. You can leave us notes if you're having any issues. We can understand what interactions we're having. So my name is Anaïs Loisillon, and I'll be moderating our session today. I'm pleased to welcome you all to our first Early Childhood Workforce Initiative webinar. For your information, this event will be recorded today and will be rebroadcast on the website of the initiative. Without further ado, let us begin now with an introduction from Ms. Kimberly Josephson. She is Program Associate for the Education Team at the Results for Development Institute, also known as R4D, based in Washington, D.C. I'll leave the floor to you, Kimberly.
Hi, thanks so much, Anais. I'm very excited to be a part of this webinar today. R4D is partnering with ISSA to coordinate this new global initiative, and its goal is to support and empower those who work with young children and families, as well as those who supervise and train and coach and mentor these workers. So this initiative is holistic. It takes a multi-sectoral perspective, looking across the sectors of education and care, health and nutrition, and protection. And it has 4 cross-cutting focus areas that we are looking at the country as well as the global level. The first is competencies and standards, and that talks about the requirements and expectations for what the workforce should know and be able to do. I'll just pause, as now on your screen you should be able to see the 4 focus areas. The second is training and professional development, so looking at the pre- and in-service training opportunities as well as career pathways and entry points for diverse workers, those with and without formal education. The third area is monitoring and mentoring, looking at systems for continuous feedback and coaching for workers to receive information and continuously improve their practice. And the fourth area is recognition of the profession, looking at the pay, working conditions, and status of these professions. So the initiative is engaging in 3 main activities. The first is creating an online presence through this online portal that you should see on your screen. And the point of this is to document initiatives and house key research studies and tools on the early childhood workforce, as well as to host these webinars, which are an opportunity for virtual joint learning. The second area of work is carrying out some analytical studies, a series of global landscape analyses across each of those 4 focus areas that I just mentioned. And the purpose there is to synthesize existing literature and evidence around the early childhood workforce. The second area of analytical work is conducting a series of country studies which seek to establish the size and scope of challenges that face a particular role within the early childhood workforce and then make policy recommendations for scaling up a quality workforce. Our first country study will take place in Peru and look specifically at community volunteers who conduct home visiting for young children in rural areas of the country. Our third main area is around joint learning, and the idea is to bring together key country actors and decision makers, global experts, and international partners to address shared challenges facing the early childhood workforce and then work collaboratively to identify and co-develop solutions for tackling some of these challenges. So that's just a quick overview of the Early Childhood Workforce Initiative, and I'm very glad that everyone can join today.
Thank you, Kimberly. That's great. So today's webinar, the first of a series of webinars that the initiative will be holding, is entitled Diversity and Identity, the Early Childhood Workforce. Research and experience emphasize the importance of a high-quality workforce and an enabling environment to support and encourage the developmental opportunities of young children during the early childhood period, which we define here as from birth through to the early school years. Providing a supportive working environment and sustaining the workforce motivation are factors which help these workers strengthen their capacity to provide children with a safe, healthy, stimulating, and caring environment. As policymakers, practitioners, advocates, and researchers, whom we all represent here today in this presentation, we also understand that the identity of this workforce is critical to providing a coherent approach to early childhood development and learning. Children and their families need support and services, and they should need to have these based on a common foundational understanding and knowledge about how the child develops and learns, about the values to facilitate their healthy development and learning, and also about a coherent and integrated set of approaches and services. Yet we also know the challenges that come with having a very diverse ECD workforce. Numerous sectors are involved in providing services to children and their families, including health and nutrition, education and care, and social protection and welfare. During today's webinar, I invite you all to reflect upon how we can build on the strength of this diversity in terms of identities, experience, qualifications, and background, diversity also in terms of their experience and skills, and capacities and competencies. And we have a great set of panelists today coming from various sectors. So before we begin, let me just spend a few seconds on the structure of today's webinar, and then we'll pass on to our presenters. So first of all, if you are a presenter, feel free to mute your speaker while you're not speaking, of course. So that will reduce any of the background noise in our presentation today. So we're going to begin with 3 presentations from our panelists, and then we will continue with a 20-minute or so discussion session, during which I invite all participants and audience members to ask questions. You can either use the questions toolbox, which is a few levels below the audio, or you can use the chat box, and we'll be collecting the questions and then using them and addressing them and during the discussion session. So feel free to write clarification questions or more general questions that you're interested in discussing. We're also using a Facebook page for the initiative and a Twitter page to increase the outreach. Feel free to use your accounts with that. On the initiative, you should be seeing a screen now, but maybe we're having a few technical difficulties today with this. There is a Twitter hashtag, which is ECWorkforce. And for the first webinar, we're using the hashtag ECWEB1, which is ECWeb1. This session is also being recorded, and we will be making the audio recordings available. This is the second session of this webinar. We had one yesterday that we will also be putting that audio feed online. We had different presenters, so you might be also interested in hearing in that. And that lasted about an hour, like we plan on going today. So moving on, I'm going to introduce the 3 panelists today and before their respective presentations. You'll also find a short bio and the links provided in the email invitation you received and also on the initiative's website. And my apologies for the screen not showing at this time. We'll begin today with a presentation from Dr. Eunice Lumsden, who is the head of early years at the University of Northampton in United Kingdom. She started working with children over 20 years ago as a social worker, specializing in child maltreatment and adoption, and her recent dissertation focused on the professionalization of the English early years workforce. She'll be talking today about the challenges in different qualification levels in England, and without further ado, I'll leave the floor to you, Eunice, and thank you very much for joining us today.
Hello, thank you everybody. I hope you can hear me all. Hopefully my presentation will come up and I will take you through it. Ah, it's there. Okay, if we could go on to slide 1, then I'll talk people through you need to do another click, I think, the system in England. I think it's really important to start off by saying that we have, often people talk about the United Kingdom, and I am going to be specifically focusing on what is happening in England. We have a different system for early childhood education and care in Wales, Scotland and Northern Ireland, which is always very interesting to us. So I think it's quite important to think that in England they look at the early childhood period as 0 to 5. So we have something called the early years foundation stage, which is our curriculum framework for working with our 0 to 5-year-old children. And predominantly up until the age of 5, if children are outside their families, they attend a variety of early childhood education and care settings, and we have something called a mixed economy of delivery. So we have settings that are for profit, settings that are charities, settings that are part of schools, and we have settings that run for 2.5 hours in the morning or run all day. So that's why we call it a mixed economy, because it's very varied. We have an increasing direction of travel with current government policy that schools are extending their outreach so that they are taking children from the age of 2 right through. And that is just playing out at the moment, so we don't know how that's going to move forward. In terms of who early childhood provision is for, we have free nursery education for our 3 to 4 year olds, and they are entitled to 15 hours a week for 33 weeks of the year. And we have a current policy direction, and the pilot is taking place next year from September 16, where parents will be entitled to 30 hours free childcare for their children. In addition to that, we have for some children free nursery education provision for 2-year-olds, which is predominantly those living in poverty. Children have to go to school at the age of 5 in England. They tend to start school in the September after their 4th birthday. So if you're born on August the 31st and you're just 5, you will start school on September the 1st that year. If you're born on September the 1st, you actually start school the following year. So there's could be a whole year's difference between the point at which children start school. Okay, do you want to move on to the next slide? That's okay. I think it's quite important to understand why we've moved to professionalisation agenda in England. It's relatively new. So before 2001, there was actually no consistency in the qualifications, and in fact most people working in our early years sector were unqualified. We then brought in national standards. So in order to be the person in charge in a setting, you have to be qualified at level 3, which is the equivalent of our old O-levels and our, it's the equivalent to our A-levels, and 50% of the workforce have to be qualified at level 2, which is the equivalent of our GCSEs, which you might know has our old O-level system. The reason for the change in England has been very much research-led, and I'll go on to that a bit more on the next slide. But what research has clearly shown, which I think you probably all know, is that high-quality, graduate-led early childhood education and care is linked to good development, and our EPI project, Kathy Silver and Co, has been very influential in shaping some of that. We also have an inspection service for our early years and for our school settings, which is led by Ofsted, and that is meant to be independent and lay outside government. And the inspections that have taken place have clearly shown a link between the quality of the setting, whether it's been judged as outstanding, and graduate leadership within it. Okay, thank you. Would you like to move on to the next slide? Okay, this is just a slide, and if you access it, there's all the links on the back of it for various policy initiatives and reports that have been published that have supported our changes in early childhood. I won't go through them, but I think it's very useful for you to have access to them because they give you an idea of what the research is showing, and I think they all sum up by saying that those in the greatest need the highest quality early years provision, and that if we invest in our youngest, then we reap our greatest rewards across society. If you'd like to go on to the next slide. there should be a, I love this absolute picture, and I hope that it has commonality against all of you that's joining with us today, which is about the importance of quality early childhood education and care that allows children to absolutely flourish. I think for me this picture captures whatever discipline we are from, what we want for our youngest children, and that's the ability to absolutely grow, to have autonomy, to be able to have everything around them, which allows, has that sunflower has, to allow children to have the best possible life chances till they die. But as we know, that is more complicated than it is to actually do in practice. It's easier to say rather than actually to achieve for our children. Would you like to go on the next slide? Thank you. I thought it would be useful for people to have an idea of the qualifications framework that we have in England. So we have been working very hard recently towards having one set of titles, one set of language that we use, because we have a range of language currently. So this year will be see our first people at level 3, which is the equivalent of A level, that have our new early years educator. And they are qualified early years practitioners that work in settings that have to have maths and English GCSE at level C in order to practice, though at the moment that's causing all sorts of issues. So as we have worked in England to improve the starting qualifications, it's actually at the moment appearing to impact negatively on those coming into the sector. We then have a level 4 qualification, which is a higher education certificate, which gives no extra status in the early years. We have a foundation degree at level 5, which is aimed at those working in early years settings and allows them to study early childhood as they work. They could, when we introduced our first graduate professional, work from that and go straight on to do what was known as early years professional status. They can't do that now. As we have evolved, the goalposts have continually changed for our people working in early years. Back in 2006, we had a graduate profession introduced or imposed by the government in England, and they were called an early years professional that had early years professional status, and their aim was to be change makers, to be change leaders and to improve the quality of early years. One of the challenges of that profession is that they were introduced by our policymakers, and therefore we've been constantly reviewing them. So they're now called early years teachers. They don't have the same qualification as teachers that work in schools, but these are specialist graduate leaders who work with our 0 to 5s, and they are qualified at graduate level. Okay, would you like to go on to the next slide, please? Okay, so I think this slide is probably really helpful for understanding the holistic nature of early childhood and the challenges we have in England. I think like many countries we have separatist professionals, so we have those that work in education, health, social care, law, who have chosen to work in their particular area. So for myself, I chose that I wanted to be a social worker. I work with colleagues from education, I work with health colleagues as well in my team. But the child actually doesn't need individual professionals, it actually needs a professional or professions that understand the holistic nature. And I think that the diagram on the right-hand side shows why it actually is such a complicated area, because there are so many different stakeholders that work with children in the youngest years. In England, the way that we have tried to address that is through our early years teacher, and they and their qualifications and the status and the that they have to achieve tries to be very holistic. So it draws on a range of standards from different areas. So for example, they have a standard in relation to safeguarding children, which is to do with child protection. They have standards to meet in relation to working with parents and other professionals. So they have a much more interdisciplinary feel about their training, and because they tend to come through our foundation degree in early years or our early childhood studies degree, they have a very holistic understanding. So they are taught and supported by an interdisciplinary team that have professional backgrounds in all the different professions that merge in that early childhood period. Okay, would you like to go on to the next slide? Thank you. From the research that I did for when I was doing my doctorate, which was on the development of this whole new profession, it really emerged that they have a whole range of holistic knowledge that they bring to the role, a whole range of different knowledge, skills and attributes. They have a relationship with teaching, but they're not quite teachers in the formal sense in school. They have a different relationship with children, so they've got to have skills to be able to work alongside a child, both verbally and non-verbally, and they have to be advocates, because children can't actually always verbalise what they want, and sometimes they need professionals that can actually speak for them and support them in their settings. They're professionals that have to have quite special relationships with a range of different parents and carers and come alongside them at different stages of development. And they really need to have this holistic leadership, so they have to not only lead practice, but they have to support others to understand the importance of early childhood. They're really important as having being professionals that are a catalyst for change, and they think they have had quite a major impact on our standards improving in early childhood. And unlike those that work in teaching or social work who are part of a big community in the settings they work, often our early years teachers 0 to 5 are the only early professional of that nature in their setting. Okay, would you like to move on to the next slide?
Sorry, I don't mean to interrupt. One of the things, I just want to make sure that you're cognizant of the time so we can have some time for discussion. So if you can try and wrap up in the next few minutes. Thanks.
Yeah, I'm on my last slide now. Thank you. This slide is, I think, people have said that they found it really quite helpful, and it's based on the work of Bronfenbrenner. And basically our profession in the early years need to work in this sort of chaotic system. So one of the really strong attributes or areas that they have to have is the ability for resilience, because policy is consistently changing. We think we're going in one direction and then we move to another. They constantly have to be working in a sector which isn't always valued, and they are constantly having to work with brand new children and families coming in. So not only do they have to have a range of knowledge and skills and the ability to communicate with others, they really have to be able to be resilient and have a real work ethos and a passion, and passion's quite an interesting one to talk about in relation to how that feels, but real aspiration and understanding of the importance of early childhood. Okay, so I think the main points that I would like to say really is that three things. One, it's relatively new. that we're developing a graduate profession in England. It has evolved over time and keeps changing because it was introduced by our policymakers rather than evolve from the sector. And that actually their interdisciplinary knowledge and the skills and attributes they bring are now beginning to actually make a real shift in the experiences and the quality of our early years. Okay, thank you.
Thank you very much, Eunice. I appreciate that presentation. Our next panelist is Dr. Antonio Rizzoli Cordoba, who is the founder and head of the Neurodevelopmental Research Institute at the Hospital Infantil de Mexico Federico Gomez, which is a National Institute of Health hospital in Mexico. He is the author of a national screening tool for child development. He is also implementing a PRADI model, which has been throughout the health services of Mexico, which is for the promotion and care for child development. And his presentation today will focus on the challenges of working across sectors in early childhood. Antonio, I'll pass the floor to you.
Okay, thank you so much. Good morning from Mexico City. Well, I would like to talk to you about the Mexican experience with the health sector actions that were together with educational sector and trying to find that holistic needs about education, health, social care, and all that Eunice talked about. First, where are right now here in Mexico? First, more than 1 million of children from 1 to 59 months have been evaluated with a CDE test, which in Spanish is Prevaedi, through all about the country. There is a manual of application for the screening tool in more than 9,000 primary care facilities in the country for the non-social secured people. There have been trained more than 45,000 people in the primary care facilities in the application of the evaluation. There are more than 300 psychologists trained in the administration of the diagnostic tool, and we're working now with pediatricians and with the educational sector. What has been happening in Mexico? First, you can see this is an analysis about investment per capita in early childhood here in Mexico for the poorest people of all, that is Prospera beneficiaries, that changes from 11 pesos in 3-year period to 2010 to 2012, and it increases to 446 pesos, which is approximately 15 to $18. And so there has been an increase in the investment, but mainly because we're trying to work together for help every child to achieve their best potential. How do we start with this? First, with the standardization and the development of a screening tool that you can see in your image. That is the Child Development Evaluation. In Spanish is EDI, but in English is CDE. It includes 5 axes, that is biological risk factor, alert signs, developmental areas, arm signs, and a neurological exam. You can see in the references the story about the development of the test.
Antonio, I'm sorry, Antonio. I just want to interrupt for a second because your screen seems to be cut on the right side. If you can maybe try and open it a bit better.
Just that I don't know how to do this.
Okay.
Maybe
we'll have for everyone who's listening in. We will have this PowerPoint presentation available for you afterwards. And my apologies if we can't see it
because of the panel thing, but I don't know how to do this. Maybe. Now it's okay? Now do you see it?
No, it's the same. I'm sorry. We saw it earlier before, but it's the same now. But we will have it available for everyone. I don't want to interrupt your presentation. My apologies.
Okay, maybe, I don't know, if you send it again, I can change it or I continue. Well, then the point is that we had an expert panel raising the question. First, there isn't a perfect gold standard, neither a universal tool for child development, and we had to review the evidence available, and we had to consider the cultural pertinence, as this webinar is about diversity and identity. The first point is we don't want standard people. We want every people to achieve their best potential. For example, we have Mayan people, which they have a particular cultural peculiarities that we don't want to change. If people use a tortilla instead of a spoon, we don't want to change it for the spoon because it could be the same thing as thinking Japanese people using instead of the sticks different parts. So we had an expert panel, and then we have to hear what is happening about the people that is going to use the tool. You can see in one of the pictures on the left the evolution of the manuals for the application of the test. And we went through different micropilots, evaluating constantly the usefulness of what is planned, what can you change, and what can you improve. And then the other point that we had is that we didn't have budget in that moment for buying materials, so we were creative, and we taught people how to use the available materials around to create ecological materials. You can see some of the materials that were created for the use of the tool. The other point, and it's about training. We have to have a standardized measure and a specific criteria for what do we want to measure. So we developed a manual, facilitator manual, in which it was specified, for example, for each of the questions, what do we want? What does it mean, low, regular, or high scores in every one of it? And what did we find? This is one study that we have recently published about differences between general medicine, nursery, psychology, naturology, or non-professional people. You can see in white the before or the initial result of the evaluation, and in purple the final results. So as you can see, we get an increase in the percentage of correct answers in the majority of the professions, indistinctive of if they were general medicine, nursery, or another professionals. But we have areas of opportunity at interpretation of the results. So the most important thing is to go and to know what is happening in the field. For that reason, we created a supervision model that is going to allow to have trustable results. We established two different models. One was the shadow evaluation and test-retest with the same results. What did we found? That no question have more than 1.5% of error, and the application errors were random. So you have to be with the people that you are training, although they have a bachelor degree or some specific training. What we found and which are the next steps? This is about the results that we have found in a population-based study. This study is about the Prospera population, which are the 20% poorer people of the country, specifically in one state in the north. What did we found? That the prevalence of children at mild risk, which is yellow in the figure, of delayed duplicates, going from 7 to 10% in children younger than 1 year old to 16 to 20% and 4-year-old. And the other point, as you can see, is that the highest prevalence of high risk of delay is at 2 years. But what happens if we see the differences between urban and rural areas defined by localities of 2,500 inhabitants? As you can see, for example, in rural areas, the higher areas of opportunity are in fine motor and gross motor, and specifically in children younger than 1 year. What happened in Mexico? That we have something called rebozo, which is a long piece of that, and the children are not allowed to move. So what are we doing right now to tell the people, okay, instead of having your child all compressed, and like in Mexico the expression is tamal, which is completely rounded, give them the opportunity to move and to walk, to crawl, to walk, and to take something in your hands. But the other point that we have found is that language is a huge problem, both rural and urban areas, and specifically at 2 years. And what is the problem behind this? That usually here in Mexico there is a concept of, oh, if my child doesn't speak, so I don't have to speak to him. First. Second, that until we're going to go to primary school, you don't have to learn something until you go to primary, which is for children older than 6 years old. So there are some of the points. What happened, and we were to know what is truly happening with children at high risk of developmental delay on the CDE test. And we did a study in Puebla, which is a state in the center of the country. We evaluated across the state 11,000 children. with the CDE test and then standardized procedure. And we got 700 children in red result at high risk of developmental delay. We randomized them and the results are shown in the figure. You can see as for children 1, 2, 3, and 4 years old. And in purple is the cognitive scores in Battelle Developmental Inventory Test. As you can see, the scores are going down and down and down and start to go really, really very low. What happened in Mexico? In the PISA evaluation, we have found at 15 years old teenagers in Mexico that close to 50% of our Mexican people failed in that test. And maybe we have this explanation starting in the first 5 years old. So for that reason, we developed a counseling modeling, and right now we are launching a national program trying to focus on a strengthened cognitive parenting practices in children. Because the most important point is to go to preschool. But for example, UNICEF said here in Mexico that half of the people 3 years old people in our country hasn't access to preschool system, and early education services are expanding. One of the most important of them is the National Council for Educational Development, that is CONAFE, that is in the educational sector, and we are starting to work together. And other point is about child care facilities. This is a study that we created with personnel that is according to what Eunice said, level 5 to 6 of educational level, and we trained them to evaluate child development, to know what is happening in this child care facilities for children 1 to 3 years old. What did we found? That the children that spend more than 6 months in child care facilities, there's a tendency to increase the number of children who do most of the activities for the age group. As you can see in the most intense green in the slide. Towards intersectional action for early childhood in Mexico, right now we're trying to put together the health unit, educational, community, and family. And there is right now an effort with one of our TV, open TV services with UNICEF about a campaign called Empieza Temprano, and with the objective of empowered population to do something. CONAFE, which is the National Council for Educational Development, and we're going to start with them and with the World Bank a study about train the promoter people that works directly in the community, in the rural communities across the country, to evaluate the child development and to encourage them to do something and to go to the health system and to create this bonding between these two areas with private foundations like Educación Inicial de Fundación Carlos Slim. They are launching now an app for the parents to know what to do with children and what to do about this, and this is free. And we have developed a tool for the connection between educational system and care unit that is a brochure in which the parents mark what does my child is supposed to do and what is going to happen. And we have reinforcing the primary care facilities about the evaluation of child development. And now in Mexico we have one psychologist, a specialist in child development, trained in the application of the diagnostic tool to be able to evaluate all the children older than 16 months with the diagnostic tool to be able to establish a profile. And with the families, it's quite important to do something. We are working with applications with the model of Te receto un juego, which in English could be I prescribe you a game, in which of take back the concept of play, because something that we have been having in Mexico is losing the concept of play. Right now, children doesn't play, or everything is so structured that we are not allowing them to be children. So, well, this is our contact data, and all of the materials are available in Spanish, free at the web page of the hospital. And, well, thank you so much for the time.
Thank you very much, Antonio. That was fantastic. And again, my apologies for the screen not showing. We have put it up on the handouts where you can download it on your computer. Also, I wanted to remind you, if you have any clarification questions for Antonio or for Eunice, please feel free to use the questions box and chat box, and we will be addressing those during the discussion period. So I'd like to move now to our third panelist today, who is Sian Williams. She is an independent consultant in policy and programming for children in Jamaica, working across the Caribbean community countries since 1993. Prior to 1993, she was also working in the United Kingdom, where she created and implemented the first integrated early childhood services. She'll present today her regional experience in the Caribbean on developing policy on supporting caregivers, as well as the benefits of the in-service training pilot program conducted in Jamaica. And I'm going to be showing her her presentation today. Thank you, Sian, and welcome to our presentation today. It seems that we can't hear you, Sian. Let's see if we can try and get this arranged. Here's her slide, at least, on the air. I'm sorry, it seems like we're having some technical difficulties. Sian is online, but we cannot hear you. Maybe we can try again. Thank you for waiting a few minutes. If not, you can think about some questions that you'd like to ask some of our earlier presenters, and you can write those in the questions box or the chat box on your screen. I'm going to ask you for a few more minutes of patience. It looks like Sian Williams is logging in. Thank you again.
Hello.
Hello, Sian. I think we can hear you. Welcome.
Oh, that's great.
Yay.
I will race through what I have unless you've moved on to other things.
No, we were waiting for you, and I saw you were logging in. So please take your time. And
yeah, I'm not sure what happened there.
Okay, your screen
anyway,
is
hello
up.
everyone again. All right, thank you. I'm going to start, first of all, it's just 2 slides. The first one addresses a public policy initiative in Jamaica. It was initiated by our National Council for Technical and Vocational Education and Training. There's a link on the notes to the slide for the work that they do. And it was a partnership with the university's Caribbean Child Development Center. And the idea was to address the fact that none of the caregivers in the Jamaican context, and we're talking about over 3,500 early childhood centers that we knew about, had any training or qualification framework to work with. We literally didn't know, in terms of policy, what our baselines were for improving practice, what people already did well and could be accredited for. So first of all, we had to bring everyone together: health, faith-based organizations, community-based organizations, the ministries of education and social transformation, as we call it, and the Ministry of Labour. And we had to work for over a 2-year period, because this is not a short piece of work, to develop a consensus on what would be the competencies for caregivers. It was a very interesting task because it externalized the problem for everybody. We didn't have to argue about what one did or the other. We just had to agree outside of us what would this framework be. And at the end of the work in '99, we had a framework for Jamaica, which then went out for a regional consultation and became a regional policy framework in 2002 for the Caribbean community. That's 20 countries who are part of that. So the content, it's interesting listening to Eunice and also to Antonio in this, because ours is similar in terms of knowledge and skills, but I think something very particular for us at that time in the late 90s was the attention to dispositions, by which I mean values, the ethics of how we work with children, and how we could measure that in the way that caregivers worked. We started with the Convention on the Rights of the Child. We started with some of the precepts of the church, particularly the Christian churches in Jamaica, and so that infused the whole framework. In terms of access to being able to be accredited in the framework, we had caregivers who didn't, on the whole, have education past what we would call grade 9, or that's when you're roughly speaking 15 years old. They generally didn't have qualifications, having, when they leave school, they just left to go into the labour force. They're either paid or unpaid. Vast army of unpaid caregivers who are simply assisting in these schools at the time. And children are generally cared in home-based or centre-based, like in church halls and that kind of very informal institutional forms, for approximately 4 to 5 years up to they go to school, which is generally between 5 and 6 in the Jamaican context. So the workplaces generally are not as organized as one might find, say, in the UK or maybe even Mexico, but they are generally home-based. Probably more than 90% of children 0 to 3 are in some kind of home-based care. Daycare is a very small number, less than 10%, and only in the big urban areas. Preschool services cover 60%, but they're community-based, and I'll come to that in a moment, what I mean by that but. So the challenges that we faced in trying to get a kind of level playing field for caregivers is mainly there was a tremendous demand for accreditation. Everybody wanted to get their certificate at either level 1 or 2, and we had to roll out a program that was basically recognizing what people were able to do now without talking about further training. That's a whole other webinar in itself, just to how to implement and go to scale with one of these workforce initiatives. The supply of assessors and trainers was very difficult. It's not as if we had a ready-made kind of senior level of early childhood deliverer of services. We had to create our ability to assess. And we also have major workforce visibility issues. Many people didn't want to come out of their homes and go through this process because they didn't want to then find themselves subject to any health and safety concerns about what they were doing. I mean, these are people with limited incomes and a very high dependency on the service continue. So bringing them out and promising training and other kinds of incentives was a major part of the initiative during the 2000s. Could I have the next slide? Moving on to the next slide. This links, because you'll see there in the very beginning, the workforce profile is very similar to how I've been describing our work initially in trying to put the competency framework in. very insecure terms and conditions of work. Wage levels entirely dependent on user fees. This is a community-based provision. We have less than 15% of children in the early childhood stage going into public provision in infant schools. So the vast majority are in community-based provision. So this has been a major area for development of standards and implementation of training. This particular training is fascinating, and it's well worth your while going online and looking for the work of Helen Baker Henningham in pursuing this approach. There are now 2 randomized controlled trials that have been published, and the 3rd is in process. And we understand anyway in Jamaica that this is the first time that a pilot of this type moved on now into the 2nd stages of efficacy and then now effectiveness has ever been done in developing country context. And so for those of you who are in developing country context, this might particularly excite you. It's basically based on coaching, and 3 sets of skills are taught in a coaching framework. One is how to create an emotionally supportive learning environment. Secondly is how to prevent and manage behavior problems. And the 3rd area was to teach social and emotional skills to children. So first of all, you're creating the environment, and then you're putting in place the skills that teachers need. Teachers I'm using because we describe them as teachers rather than caregivers. It isn't the same as denoting a qualified member of staff. The training is only 5 full-day training workshops over a year, 3 to start with and the other 2 interspersed. The coaching is done monthly in class, and it lasts for 1 hour over 8 months. And then there are weekly text messages to encourage and spur along the teachers. And it's been very, very interesting, the effects. The experience has been one of great success from the point of view of the teachers, a big increase in practitioner skills and confidence, and in the focus groups that have been followed up and now published, they talk about their enjoyment of children. I wanted to point out a couple of things which are in the notes that you will receive of this. This program is going to be published shortly online for a free download. It's going to be called the IRE Toolkit. It has a very Jamaican flavor to it. It is very much directed, I think, in a very straightforward way to teachers' struggles with trying to manage large, noisy classrooms of children and trying without many resources to make their days as stimulating and as good as possible. Of course they run into discipline problems. Of course it's difficulty managing the numbers. But the training has produced a decrease in conduct problems, not only in the school but also at home, increased social skills, much better school attendance. We have phenomenal enrollment in Jamaica. Everybody's enrolled, but coming every day and being able to participate every day is much less, and much better quality in the classroom environment. The children have been followed into grade 1. That's our first year in primary, and you'll be interested to hear that their ability to succeed in terms of schoolwork, in terms of their cognition and continuing development on all levels has continued and is better than children who have not been through schools that have had this support. But interestingly, their behavior has not maintained at a good level, and in fact that has been a drop-off. We're not sure why. The new randomized control trial will be looking at that in particular, but we sense it's because they've moved to different teachers, they've moved to much bigger environments, sometimes 40 or more children, a much harder curriculum to immediately adjust to, and of course much more formal instructional modalities for that. So we're going to be looking at all of that. When I say we, I'm speaking just as somebody who lives and works in Jamaica. But do look at the work of Helen Baker Henningham on this. She's leading an interesting team across large urban and rural parts of Kingston and its immediate environs in Jamaica. And this work is extremely encouraging for believing that you can coach the kind of skills for supporting emotional and social development. Thanks, Anna-Eve. I'm so sorry about the connectivity problem earlier, but I'll stay online.
Thank you very much, Sian. I appreciate it, and thank you again for being able to go through your presentation and understanding quite a lot of information is coming out of this work in Jamaica. I'd now like to open up the seminar to questions from the audience. We have a few that have arrived. Feel free to keep posting your questions and chat in your frame if you have any problems doing that. There is a chat function which I can read and assist you with. I'd like to start with the questions that you'll see in front. So the first question comes from Ronan Magnan from SOS Children's Villages International. And he would like to ask how much the materials and services developed are anchored in the United Nations Convention on the Rights of the Child, and also what emphasis do the trainings place on professionals to adapt a child rights-based approach to their work in early childhood education and care, particularly with the most vulnerable children. I'm not sure who this is addressed to, so if you have a particular person who wants to answer this, feel free to start.
Shall I answer first? It's Eunice here. Can you hear me?
Yes, thank you, Eunice.
Okay, right. I think when I was very lucky to work on the standards for our early years teacher and our early years professional beforehand, and underpinning them, I think, is the rights of the child to a highly qualified workforce that's aspirational. So although I wouldn't say that it was linked specifically to the UNCRC, it underpins the whole of the work of the new professional, and part of what they need to do is to absolutely advocate at all levels for the rights of the child to that very high quality service that we know will make an impact on their future outcomes. Okay, I don't know if anybody else wants to come in on that.
Yes, I would like to talk about this in the Mexican experience. Do you hear me?
Yes, can do.
Yes.
Thank you. Well, for example, here in Mexico, we have now a law for the rights for children and adolescents, and we're changing to a policy based on child rights, in which the main difference is that instead of the children being beneficiaries of the rights of their parents, they are by themselves persons with rights. And I will give you an example, specifically, Ronan, with the identity and how are we measuring it, even with pediatricians in training. One problem that we have in Mexico is that close to 5% of children at 4 years doesn't know their name. So the identity is not just to have an act of birth, a certificate of birth. It includes to empower the family to talk to their children. First, think, how am I going to name my children? Second, to talk to them, because they have a right to the identity since the moment they are born, and to have a name and to be named by that. So we're changing here in Mexico to centering everything about the rights of the children and to empower families for them to have the rights in everything that we're doing. This is what we are changing right now.
Would you like to add anything on this?
I think it's really difficult to actually get people to really thoroughly understand and embed the importance of the United Nations Convention's rights of children, so and ensure that a rights approach is put into place, because we have so many different conflicting policy issues that sometimes get in the way of actually ensuring that all the policies that are developed are actually linked in for children into that, and actually recognise the importance of them as being rights holders.
That's a great point. Thank you, Eunice. It's a very good point. That I think this is something that we're going to see in many different countries. Let's move on to the next question from Chloe O'Hara, which is, what is the thinking about quality of care and compensation for unpaid caregivers, that is, parents in the home? And also, what about paid caregivers for the 0 to 2 age group and differentiating their expertise, my apologies, from preschool-focused educators? Thank you for that question, Chloe. Is there something you? I would think Antonio and Sian would have some different experiences in this, because it does.
Yes, I could come back on that.
Yeah.
The second part first. The Jamaican experience and now the regional policy has a differentiated set of competencies for children 0 to 3, and there's a particular focus within that on infant care. So that's part of it. But the other part of it, could you just read the first part of the question first? Was it about being paid or about how unpaid carers would have access to the training?
It's more about how unpaid caregivers, parents, the example was parents in the home, about how they can think about quality in care and compensation. So it's a mix of both, actually.
Well, again, in the Jamaican context, they are eligible, particularly if they're caring not only for their own children, but for children of neighbours, to go through this competency framework and to be certified. I mean, literally, to have a certificate that they are competent to care for their neighbours' children. That, as I mentioned earlier, really helps bring the visibility to the work that they're doing in terms of support for others. It doesn't necessarily bring them any compensation level at all, let alone any more than they might have been getting, but it does bring them recognition, and it does bring them opportunities to participate in wider training. That's partly because the entire sector is driven by user fees. So if your neighbours or the people you're looking after your kids are having as low an income as you're not going to be generating much there. There isn't wide state recognition of trying to support parents and caregivers in that situation. It's one of the areas that we want to improve, but poverty rates are very stubborn, and for us they're at 16.5%, and we have a greater group of people that we describe as the working poor, approximately 22%, who without the support of somebody who isn't charging you very much would not be able to work at all. So it's a difficult situation in which the economic imperatives are really driving it. But in terms of their access to training and their recognition as caregivers, that opportunity is there for them to come out and get that certification.
Can I add something?
Of course, please do. Thank you.
Oh, thank you. Well, for example, in the Mexican experience, about unpaid caregivers, specifically parents, what we have found is that the best compensation they have is for they to have healthy children and to achieve the points. And about, for example, caregivers for 0 to 2 years old, we have 3 different models. First is about women in the community, that they are doing workshops within the community, being unpaid, and we have found that they are leaders of the community, and they are willing to do some of the things at the community with the empowering of them. We are conducting a study about the impact of these workshops in the child development, starting from the pregnancy. And we have 2 paid experiences. First is the child care facilities of DIF Nacional, which is a program focused on the development of the family, starting with these facilities for working mothers. And the results that I showed you were about this kind of care facilities in which there is an increase in the child development compared with the children without that kind of assistance at that facilities. And the other part is for the community agents for the National Council of Educational Development, which is CONAFE, and they were starting to evaluate what is the impact taken as a reference as the child development nominally, child by child, to know how impact does it have in the development. But we haven't found so much differences between the preschool and the early childhood because of the training and because of the need of them to be trained and to focus on supervision and continual educational models.
Okay, can I just come in as well on one point?
Yes, please.
If that's okay.
Yes.
And I think I just want to highlight in England that we're having and seeing a beginning to see a shift in terms of the very early years and the early years, if that makes sense. So a focus on the sort of the conception actually to the age 2 period. And within the training for the new early years teachers, our graduate professionals and our early educators, there's a huge focus on the 0 to 2 child or the 0 to 3 child, and there's a huge focus on what the baby room experience is like in early years settings, and you know, we're trying to apply all that knowledge that we're beginning to get around brain development, about the importance of language development. So I would say actually we have quite a few initiatives within the English context around that baby room experience and the quality and the training of the staff, because traditionally it has been the lowest qualified staff that worked with the babies, with frequent numbers of caretakers, whereas now we have much more of a key worker system and much more focus on attachment and that very early experience for our youngest children. And we also have our system of childminders, which is care within the home, where predominantly other women or women and their partners provide those sorts of services, and that is highly regulated and also comes under our Ofsted framework, and they also have to deliver our early years foundation stage curriculum framework, which is from 0 to the age of 5. Okay, thank you.
Thank you all for that. Let's move on to the next question. I'm cognizant of the time, and we're running a little bit over time. My apologies to those. We have 2 more questions that were sent in today, and if you have more, we also will be continuing this conversation via Facebook over the next few weeks. On a website, we will be showing you the link at the end of the session. So this is a question for Eunice from Janet van de Corport. Excuse me for the pronunciation. Could you tell me if the pilot for 30 hours free nursery education is for the children with disadvantages or for all of them? And also, for how long will it run, and what are the aspects that they will evaluate, and what happens afterwards?
Ah, really complicated question, thank you. I don't think I can answer all of it, because at the moment it is being a very contentious policy area that is being piloted, and in a number of our regions in England. And there are different models happening in different places which the government will evaluate. I presume that has gone out for tender, and I've been looking to see if I could find the answer for you about that, but I will do and ensure that goes onto the Facebook page. It is for all children, but there is going to be some sort of criteria applied, and all of that is just being developed. It came out of a pledge at our last election by the Conservative Party that if they got into power, they would give parents 30 hours of free childcare. it is proving incredibly complicated to put into practice, because there have been real challenges for settings to know how they would fund it. So that we are just getting out now some data from local authorities saying how they will actually implement it, because originally the government weren't giving enough money per child to the settings to make it worthwhile for them to actually offer the free childcare in the first place. So it really is a little bit about watch this space at the moment to see how it actually comes into fruition. It was also something that was pledged by our Prime Minister that is no longer our Prime Minister now, and we have a new Prime Minister that's been sworn in this afternoon. And I think the early years workforce is looking and hoping that some of the direction of travel we've been going in all of these areas is continued. But as I say, it works if you think about my PowerPoint and that chaotic system. Yesterday we were going in one direction and today we'll be going in another, and we're not quite sure how that's going to pan out for the 30 hours childcare. Thank you.
Thanks for that. And then we have another question from Antonio Rizzoli, which are, what are the types of challenges that you have observed in your intersectoral work? How have the health and education sectors collaborated? And what is the role of parents in this transition to intersectoral work around children?
Thank you for the question about a lot. The first one about intersectoral work was to have a common language and to try to work together. I think that was the most difficult thing. When we started to work, educational sector had one type of evaluation, child care facilities has another, health has another, and inside the same health care system and the health ministry, the Ministry of Health, there was a different kind of evaluations. So the first was to have a common language. For that reason, for example, what we developed is we have now a screening tool for the health system, and we adapted for the educational system in a way to be able to communicate and to be able to be a way to interchange and establish a referral system. We created a brochure that is going to be used in preschools and in CONAFE, which is the educational system, community system, educational community system, and in the childcare facilities to refer to the healthcare unit. What we structured is a different point. For example, the objective of the child development evaluation in the educational system is to know what areas of opportunity does these children have, and how to improve them. And the main point of the health system is to early detection and treatment of problems. So this is one of the points. How are they collaborating? First, well, national base is a national council that is structuring together the education and health systems. We have now brochures, we have now evaluation that can be interchanged, and everything is available online. And what is the role of parents? It's the most important thing. First, because we're changing to say, first, child development is not a problem for parents. Is a concern for everyone. If I am walking on the street and I am looking right at my cell phone and I'm not interacting with anyone, and a child is right behind me, he or she is seeing me, and he's going to know that an unknown people hasn't anything to do with them, and they are not going to have to do anything with anyone. So what the first point is that child development is something that it has to do with everyone who has in contact or in touch with children. And second, parents must be the leaders, because we can do a lot of things in school, we can do a lot of things in health system, but if the family doesn't encourage them in the house, it's not going to be able to do that, because child development is responsibility of everyone. It starts since pregnancy, and every day since the child is born, has been born, you have to do something to help them to achieve the best potential.
Thank you for that. We've now passed 20 minutes into our session, and I thank you everyone for the participation. I'm thinking that this is probably a good time to end the session, and we will put online the questions and also the different documents that were available. You should be seeing on your screen now the website and also the Facebook links that you can see. So the Facebook connection is EC Workforce, where we'll be continuing this conversation. And if you have other questions, and our presenters, as well as people from R4D and International Step-by-Step Association and myself, will answer these questions. We'd also like to take this opportunity to thank our panelists today who have enriched our minds with all these interesting examples from different countries. I mean, we've seen a lot of the discussion on the benefits of science and how to increase the focus on social emotional development and attachment with parents in Mexico and with caregivers in England, as well as evidence on how to improve social emotional learning environments in Jamaica. And I think this is really exciting work. We've also talked about the intersectoral work in the United Kingdom and Mexico and Jamaica. So I think there are a lot of rich resources, and this is an interesting field. We will be continuing in the webinar series later this year in September. It's been a true pleasure speaking with all of you today and hearing your participation. Many thanks again. Have a nice day, and I'm going to stop recording soon unless any panelists want to add some points.
No, just to say thank you very much and look forward to the next time.
Yeah, thank you. Same from me.
Thank you very much. Thank you, everyone, and have a good continuation of your day. Thank you for all the audience for attending. I will now stop recording.